presentation is brought to you by Therapeutic Articulations, the creator of the MobilAider orthopedic device and iOrtho mobile app. This presentation is about ACL testing. ACL injuries are a significant problem. They account for close to 250,000 injuries per year, and that doesn't count the number of re-injuries. In addition to identifying the mechanism of injury and symptoms such as popping or audible sound, immediate swelling, and instability in weight bearing, clinical tests are very important. These tests include things like the anterior drawer, the Loli Test, Lachman test, and the use of an arthrometer. In spite of the presence of these tests, 74% of acute ACL injuries are misdiagnosed in the emergency department. The anterior drawer test involves placing the knee in 90 degrees of flexion and creating an anterior translation of the tibia on the femur. The metrics for this test are quite variable, given that the interpretation for a positive test involves identifying increased linear translation or laxity and an empty end feel. There are a number of causes of false negatives of the anterior drawer. This can include a hemarthrosis and active synovitis that prevents putting the knee in the 90-degree test position to begin with, protective knee guarding of the hamstrings restricting anterior translation, and posterior horn medial meniscus wedging against the medial femoral condyle that can block anterior translation of the tibia. The Loli test appeared in the literature in the past decade, and this involves placing the person in supine with the hip and knee extended. The clinician puts his or her fist or a foam roll under the proximal third of the tibia, and the other hand exerts a downward force, like posterior in the posterior direction, over the distal third of the femur. With an intact ACL, the proximal tibia translates anterior, and as a result of the lever system that occurs, the foot then comes off the table. If the ACL is not functioning, then a positive test would be the failure of the tibia to translate on the femur, and the heel of the involved leg would not rise off the table. Although the metrics for this test are fair, it's still pretty much a binary test, right? Either it's positive or negative. The classic Lachman's test has been around for decades, and it involves, again, translating the tibia on the femur. Here's a video of the performance of that test. The red glove is stabilizing proximally, and the green glove is translating the lower leg anteriorly. And as you see, there's an abrupt end feel, indicating an intact ACL. Again, these statistics are better than some other tests, particularly that of the anterior drawer, but there's still a pretty big range. And that's because there are, again, a number of issues with the performance of the lock. Protective muscle guarding of the hamstrings can restrict that anterior translation. Posterior horn of the meniscus, again, can wedge and prevent that translation. But even more so, there are issues related to the mismatch of size of the clinician's hands and that of the patient's leg. Most clinicians are going to have a hand span of somewhere in the vicinity of 6 to 9 inches. Yes, yet an awful lot of individuals who suffer ACL injuries will have thigh circumferences that exceed 18 to 23 inches. That creates a significant problem in being able to stabilize proximally with enough force and stability to be able to then quantify that linear translation of the distal segment. So the inability to actually quantify this motion in the millimeters that we're dealing with is a significant problem. The MobilAider device was designed to address this pain point, right? To provide a quantitative value on the linear translation of the knee. Here you see the MobilAider device being assembled for the use for the knee. So you see a proximal attachment with a strap, and then a distal attachment with a strap that has specific dovetails that slip right into the slot to stabilize the device. The device is placed on the knee in a position of 15 to 20 degrees of flexion, the optimal position identified for the Lachmans test to minimize some of the problems that we just discussed. And then the device is stabilized with the device aligned with the joint line of the knee. And you see that being confirmed right there. The proximal segment is stabilized and the distal segment is translated. Again, you see an intact knee with an abrupt end feel, but you see the device translating and a quantitative value is displayed on the LED, as you see here. You can also perform a ProLachmans. This allows you to translate the tibia anteriorly with the assistance of gravity and not having to worry about stabilizing the proximal segment. There are 3 different techniques here that are demonstrated. But again, although there are advantages, there are also the disadvantage of not being able to quantify it. There's no need to stabilize the proximal femur. The thigh girth to clinician hand size is no longer an issue, right? You're able to palpate while performing the test. There's a decreased likelihood that the tibia resting in a posterior translated position will cause you to think that this could be a PCL injury. A prone position can be comfortable for the individual and allow them to relax the hamstrings, and gravity assists in the performance of these tasks. But once again, there's no ability to quantify these values. So again, this is where the MobilAider comes in. By attaching a different device or a different attachment here, you see a yellow attachment, stabilizing proximal, moving distal, as shown in this video. Right, proximal attachment is slipped in, dovetail secures it in place, stabilize proximal, translate distal. Clinician has a great line, forearm is in alignment with the direction of force, enabling the clinician to view the screen the entire time and see the magnitude of the linear translation. Again, the ProLachmans test has some decent metrics, but when you add the ability to quantify that with the MobilAider, it becomes incredibly powerful. The MobilAider has been tested for reliability and validity, and you can see the scatter plot here and the associated statistical values. And here you see on these videos, on these radiographs, you see a 6.9 millimeter translation measured on the radiograph, and that reading was 7.1 on the MobilAider. That is less than a 2% margin of error in the testing of the device. And it again can be a very powerful calculation, a powerful number for you to utilize in the assessment of an ACL. This data has been published as a proof of concept in the International Journal of Sports and Exercise Medicine, as well as in the Journal of Sports Rehab. If you are interested in obtaining more information about the MobilAider, please contact me at info.iortho.xyz or visit the website at iortho.xyz. Thank you.